Hi everyone. Today we'll be talking about oppositional defiant disorder. What is ODD? Oppositional defiance disorder is classified under the Disruptive Impulse Control and Conduct Disorders section of the DSM-5. In children with oppositional defiant disorder, there is an ongoing pattern of uncooperative, defiant, and hostile behavior toward authority figures that severely interferes with the child's day-to-day functioning. It is important to remember that oppositional behavior is a normal part of development for various stages and ages. This behavior becomes concerning when the frequency and consistency of oppositional behavior stands out when compared to other children at the same developmental level. The DSM outlines various symptoms and patterns of behavior that would qualify an ODD diagnosis. These symptoms include angry or irritable mood, argumentative or defiant behavior, and vindictiveness. It is important to note that children under 5 and above 5 will meet different frequency criteria in order to qualify for a diagnosis. For a more comprehensive look into the diagnostic criteria of ODD, please refer to the DSM-5. The rate of oppositional defiant disorder may vary depending on the age and gender of the child. The average prevalence of oppositional defiant disorder estimates around 3.3%. The disorder appears to be somewhat more prevalent in males than females prior to adolescence. The male predominance is not consistently found in samples of adolescents or adults. The prevalence of the disorder in children and adolescents is relatively consistent across countries that differ in race and ethnicity. It is important to remember that ODD occurs on a spectrum ranging from mild to severe cases. A mild case is when symptoms are confined to only one setting. A moderate case is when symptoms are present in at least two settings, and a severe case is when symptoms are present in three or more settings. ODD is a unique diagnosis as it requires consistent effort from both the parents and the child. There are many potential effective strategies for parents that can help their child, such as proactively teaching their children to creatively problem solve. Modeling effective communication and creative problem solving is another effective strategy for parents. Using consistent, evidence based discipline and protecting children for trauma are other effective strategies for parents. On the other hand, it is up to the individual in the treatment to manage their symptoms by learning various strategies in a therapeutic setting. These strategies involve improving social skills, practicing positive ways to respond to stressful situations, improving communication skills, and understanding the connection between their emotions, thoughts, and feelings. There are three common approaches used in ODD treatment are parental management training, cognitive behavioral therapy, and play therapy. In parent management training programs, this teaches the parents and other family members how to manage the child's behavior. Parents, family members, and other caregivers are taught techniques in positive reinforcement and ways to discipline more effectively. In cognitive behavioral therapy, when a child is slightly older, CBT in different formats is a very useful component of the treatment of ODD. Problem solving skills, training, and perspective taking are components of effective CBT model for children with ODD. In regards to play therapy, ODD is more commonly diagnosed in children. Young children may struggle to understand or express their emotions. Play therapy offers an alternative outlet. Through play, children can work through their emotions, understand their behavior, and master new coping skills. Parent management training is the treatment of choice to prevent disruptive behavior for many mental health professionals. PMT focuses on parent skills and how the parent interacts with the child. This approach includes teaching parents the importance of quality time and differential reinforcement strategies. This approach embraces the following principles: increase positive parenting practices, such as providing supportive and consistent supervision and discipline, decreased negative parenting practices, such as the use of harsh punishment, and focus on inappropriate behaviors, consistent punishment for disruptive behavior, and predictable and immediate parent intervention. Classic evidence based PMT programs, such as those by psychologist Dr. Alan Kasdan or Dr. Russell Barkley, or the Generation PMTO program, are proven effective. Other effective methods of PMT include parent child interactive therapy, in which video based monitoring and feedback are utilized to make parent training easier. These parenting programs can be effective across economic classes and ethnic variation. One valuable resource mental health professionals can utilize can be found on Dr. Alan Kasdan's website on parent management training. Here he provides various downloadable forms for clinicians that correspond with each session. These worksheets include common open ended questions and various therapeutic activities. There are also a variety of programs that were created to support families and children. These programs can be utilized by clinicians, families, and schools. Providing proper education to parents is also incredibly important. Parents need to understand the importance of being proactive instead of reactive. These books can help provide the insight into understanding of ODD. Another technique that is commonly used in a therapeutic setting with an ODD client is cognitive behavioral therapy. Child focused CBT involves providing an appropriate therapeutic environment, teaching relevant coping skills, and then creating opportunities to practice them with the hope of fostering new learning. From this perspective, child focused treatment of aggressive youth would involve the teaching of various skills, such as emotion regulation, cognitive restructuring, and problem solving, providing opportunities to practice the skills, shaping by the therapist of this practice, and a collaborative and comprehensive understanding of the benefits of the newfound skills. Evidence strongly supports cognitive behavioral treatments as the first line of care for ODD and conduct disorder. Children with ODD often only know the negative ways of interpreting and responding to real life situations. Teaching them cognitive problem solving skills shows them how to identify various situation and respond appropriately. There are many CBT techniques that can be applied to a client with ODD and achieve successful results. Four widely used CBT interventions and mental health professionals utilize are relaxation training, problem solving, cognitive restructuring, and contingent reinforcement. Relaxation training focuses on breathing exercises and progressive muscle relaxation. Social problem solving identifies or discovers effective solutions for stressful or triggering situations. Cognitive restructuring replaces stress producing thoughts with more balanced, positive thoughts, also known as reframing. And contingent reinforcement allows a therapist, parent, or caregiver to exercise discretion and guidance in reinforcing certain beneficial behavior and avoid providing reinforcement for an undesirable behavior. Alongside one to one treatment, there are also programs such as the Anger Coping Program to help individuals with ODD. The Coping Power Program is another program designed to help children with ODD. This program is a cognitive behavioral group intervention that is designed for use with aggressive children and their parents. It is often implemented near the time of the children's transition into middle school. There is also a parent component of the program, which consists of 16 group meetings held during the 5th and 6th grade school years. Play therapy can be an extremely useful approach when working with younger children. Play therapy can help individuals communicate, explore repressed thoughts and emotions, address unresolved trauma, and experience personal growth, and is widely viewed as an important, effective, and developmentally appropriate mental health treatment. Play therapy is thought to be one of the most beneficial means of helping children who are experiencing emotional or behavioral challenges. Play therapy may benefit the child in a variety of ways, such as encouraging creativity, promoting healing from traumatic events, facilitating the expression of emotions, encouraging the development of positive decision making, and introducing new ways of thinking. There are hundreds, if not thousands, of various play therapy interventions. It is important to choose a play therapy technique that is appropriate for your client. For example, if a client does not like coloring, the Color My Feelings intervention may not be the best choice. Furthermore, if the client cannot read or write, creating a sensory bottle may be a better approach for the client. Now it is time to put this knowledge into practice. Let's imagine we are at a session with a client who has ODD. It is imperative that a positive therapeutic relationship is established with the client. When engaging with a child with ODD, it is important to approach them with a calm and soothing voice. Since most children with ODD struggle with authority figures, it is important to provide a calm and supportive environment. By setting a few non negotiable therapy rules, um, the child knows what is expected of them and why. This can be a collaborative activity if the session allows for it. Lastly, it is important to acknowledge the wins, big or small, to reinforce positive behavior. The box breathing technique is a really powerful tool that could really help children with ODD. So it's really simple. You picture a box, and first you're going to inhale for 4. So 1, 2, 3, 4. Hold. Exhale, 1, 2, 3, 4, hold. Inhale, hold, exhale, hold. It's really simple, can be done anywhere, and it's great for children to implement when they're feeling triggered, stressed out, overwhelmed, or just generally unwell. Another technique I really like is the worry box. It's a little box you can create where the children are encouraged to write down things that are bothering them. You put the worries in the box, and depending on what you agree with the client, you can go over them or they can stay private. But this encourages the client to release their feelings and to just share how they're feeling. If they're feeling bothered, they don't need to bottle it up. Um, and it just gives them a healthy way to express everything that's happening. All in all, there's so much information, resources, and support for individuals who are affected by ODD and mental health professionals who come across clients with ODD. I really hope this presentation was helpful, and here are some resources for you to do further research. I hope you enjoyed my presentation.